All right, let's do it.
All right, Dr. Micallef, welcome to Austin. Thanks for taking time out of your busy schedule to come down here. I know you've been with us for about 6 months now and figured we'd give people maybe a little update about how things are going in San Antonio. I know you've been rocking and rolling, and so give the world a little update. Everybody wants a little more Micallef in their life.
Hey, there's a lot of me to go around. So things have been great. You know, we hit the ground running. We've had a great time in San Antonio, really welcoming the demographic and the population that we've had in San Antonio. We've even captured some of the Austin population just to kind of alleviate the backlog that's been happening a little bit in Austin. So things have really been good. The med spa has been up and running. Andrea and PA Gilbert have done a fantastic job. We've got a fantastic crew. We've seen some reviews that have been phenomenal coming out of San Antonio. So really some really good things, and super exciting to see what will happen in, the next 6 months.
And if you don't mind, we get a lot of questions about you, San Antonio. Do you mind if I rapid fire some questions at you?
Of course,
because
let's do it.
I think that'll be helpful. So number one, asking, do you perform surgeries physically in San Antonio?
I do. So we use Emerge Surgery Center at present, which is literally just a skip away from our office right down the street.
And then people were asking, is it most of the same surgeries that we do in Austin? And if you don't mind, because I know overall the answer is yes, but I think if you don't mind, I'm going to run through just a bunch of surgeries and you just tell me yes or no, whether you perform them in San Antonio. Breast augmentation.
Absolutely. We even have a little breast augmentation special happening in San Antonio right now.
Yeah, so we got $1,000 off in San Antonio, breast augmentation, but I think they have to get in for their consult before the 14th, 10th, something there. Yeah. Maybe we'd give them a little leeway. But and then surgery before April, getting you basically spring break ready.
Yeah, a little spring break ready, get that body ready.
How about internal bra stuff? Using the Galfex, Durabsorb, common procedure you do?
It is. I can't talk enough about, the necessity, especially in patients who have had massive weight loss, revision procedures, really to help kind of support and contour that breast.
And I think sometimes people forget, just because you're new to our practice doesn't mean you're new to the world of plastic surgery. You've actually been doing complex breast revisions, reconstructions for a long time with the military. And so you actually have some experience with some of these new novel meshes and internal bra stuff that I'm trying to glean from you. And I think sometimes people think new to the practice means new to the world. Not true at all.
Not true at all, right? So I'm the only thing that happens to be new is I'm finally double board certified, finished that process for the American Board of Plastic Surgery now. And so it's been a super exciting couple of weeks since I found out those results. And, but otherwise, not new to the world of plastic surgery, and definitely not new to the world of cosmetics or reconstructive plastic surgery.
What about BBLs? Because, that's a bread and butter, something that I love. And it's actually been, great since you joined us, because I feel like in the world of plastic surgery, BBLs, plastic surgeons have a love-hate. Some people love it. Some people have zero interest in it. Maybe share where your interests lie with that.
I have a lot of love for this procedure. I mean, I think that the ability to really contour the waist and really give some beautiful volume and shape and, really feminizes the woman. And I just don't think there's a ton of procedures that we do that. We got, of course, it combines two of the best procedures. It combines a liposuction procedure, where it really kind of extracts all that extra fat from the waist and really contours that waistline. But then we also take all that fat and put it into those hip dips, those that no one really loves, right? And really gives that beautiful silhouette that we're all looking for.
And we've had people who've worried, like, well, if I go to San Antonio, since that office just got up and running, I won't get some of the technology, some of the stuff that I would get in Austin, but that's not true.
That's not true in the least. Yeah,
we have the same ultrasound. We actually have the exact same ultrasound. Yeah. Yours is actually newer than mine, and it was funny because our Renuvion rep was here and like, oh, if you upgrade to the newest one, you can trade in the older one that you have down in San Antonio. I was like, well, actually, they have the newest Renuvion in San Antonio.
We got the best equipment in San Antonio. We're just waiting,
and actually have and I don't even know if we've shared this with anybody because we just got it last last week. Actually have a brand new Vaser in San Antonio.
We're super excited to start doing some of our high definition liposuction cases down in San Antonio with a little Vaser action.
Let's talk about that, because HD lipo is something that has just caught on fire, because I know especially in Austin, people are looking for more of that athletic. I feel like there's a little bit of a trend change too, where, you know, rather than just a big butt, people are looking for this like athletic figure. I've also gotten a lot more push. They're like, hey, I want a tummy tuck, I want lipo, I just don't want to look fake.
Right.
And I think HD does some of this, so you don't have that overly lipoed look, that you can look super athletic.
Yeah, and I know you've touched base on this numerous times in the past, but you know, there's so many variances to high definition liposuction, but you know, implementing the Vaser really gives us the ability to really kind of contour just some beautiful, elegant, but some aesthetic lines for people without going a little too far and too fake in that realm.
And then I think one of the things that has exploded is men getting HD lipo and lipo. And I know you do a lot of that as well, because men need love too.
Yeah, they absolutely do. And honestly, we see a ton of people, a ton of males, and even in the transgender population that want some high definition lipo, really just to help define or push them to that ability to look just a little bit more refined or a little bit more athletic that they're just not able to get in the gym.
Any last little nuggets you'd like to leave for our visitors and our longtime viewers, sometime DMers, about San Antonio and about a little bit of Micallef madness?
No,
or Micallef magic, maybe.
A little
maybe
Micallef magic is happening in San Antonio. We're doing everything that Dr. Franco and the team up here in Austin are doing. So would love to meet you. Come on by anytime. And if you see me before the 14th of February, we can get you a little spring break ready.
It's pretty cool, because we say Micallef madness, but it's a little bit of combination of madness and magic that really gets people
That's right.
bikini body ready. So
right.
Appreciate you guys listening. We'll see you in a little bit.
See ya. Bye.